Crockett, the director of the clearinghouse, the statewide clearinghouse for the Tennessee Alcohol and Drug Association. And Ms. Crockett, before we left, we were talking about some of the things that you are involved in as the director of the statewide clearinghouse. But before we finish this program for today, let's have you to talk about two general areas that might be helpful to our viewers this morning. Let's first of all have you to talk about the various kinds of programs that you're involved in, and after that to talk about the kind of services that you render. That would give you an opportunity to give that kind of information.
In 1994, when we received enhanced funding from the Tennessee Department of Health, they coined that initiative the Community Education Initiative. And in essence, what it gave us was several more staff, the Tennessee Red Line, an opportunity to promote A&D services across Tennessee, which historically had not been done. So what we are trying to do in our office is make appointments across Tennessee at different media outlets and have the providers that are funded by the Tennessee Department of Health to meet us at those outlets, and we'll record a show together, or we'll go on the air on a morning drive show, or whatever the case may be, to promote alcohol and drug abuse services and to also promote unity among people in the alcohol and drug field. In case, you know, somebody had a problem with that, they could see that, yes, we do work together. We might be a prevention program, and they might be a treatment program, but we work together towards the same common goal. When I say the programs of the Bureau of Alcohol and Drug Abuse Services, there are many and extensive programs. There's something new coming up soon with Governor Sundquist, the Governor's Prevention Initiative. I don't know too much about it yet. Can't give you very much on that. But the Bureau funds several hundred programs that involve prevention and treatment services all the way across Tennessee. And we're just happy to be a part of that circle.
Now, what are some of the services that you render with those programs? I mean,
well, one of the things that
in the sense of what can you tell our audience this morning of the impact that some of these things have had upon individual lives?
Well, one of the things that we do is we supply the tools for professionals to help them, if it's treatment programs or if it's prevention programs, we give them the latest information that's available on risk and resiliency factors or on treatment issues, whatever the case may be. It's our job to get this information out into the hands of those people that can then study it and make a difference in somebody's life. We know for sure we've saved lives. We don't have, because we don't ask names, we don't have a litany of names we can just call up, because we tell our callers when they call us on the Tennessee Red Line that the call is confidential. And it's not a narc line. I've had that question asked several times, and we don't want to know how much money you make or where your husband works. That's not an issue. We just want to get you referred as quickly as possible. One of the things that people have calling us for is referral for everything. We have over 1,600 providers in our database that we use to do referral on. These providers include emergency shelters, it includes food banks, it includes programs outside of the Department of Health, it includes police departments, sheriff's offices, anything that it would take to help put a family back together again, including information on individual counselors. If you don't have a treatment issue, you might just want to go see a counselor or an employee assistance program on drug testing, on other health-related issues. That's basically the direction I'm trying to move our clearinghouse into, is the direction of health-related issues, because substance abuse touches so many areas that it would be foolish for us to sit there and think that we're only going to cover this subject and not touch anything else. You
know, as you explained that, Ms. Crockett, I think one of the things that is apparent that when you talk about drug abuse and alcohol, that you're talking, you know, all the services you mentioned all across the board.
Yes.
You're talking about almost every organization and every service.
Yes, absolutely.
In the community.
Absolutely.
I mean, nobody is left untouched. The police department is impacted by it.
The workplace.
Every aspect of it.
The church groups. I mean, we work with essentially everybody in Tennessee. We work with civic groups. We work with organizations like the Girl Scouts and Boy Scouts. We work with businesses that want to put together a drug-free workplace, don't know how to put together an EAP, don't know anything about drug testing. We get them information immediately in the mail to them and give them referrals on who to call at the state level or the national level or the local level. That's the beauty of our service, is that we're not just sitting there with just alcohol and drugs. We're sitting there with information to help put a family back together or help a workplace.
Now, is this organization duplicated throughout the nation in other states, or what? Is this something unusual in the state of Tennessee, or what?
No, it's not. Now, two things I wanted to touch on because you brought that up. There are clearinghouses in all 50 states, the Virgin Islands, Puerto Rico, America, and Samoa. We were all connected electronically, but the funding was cut for the electronic communication called Prevline. So they have gone now to the World Wide Web. And unless you're on the internet, you won't be able to be connected together. That service is over with. But the clearinghouses all across the United States, we all know each other and we all have a good relationship. Now there are also associations like ours in other states. I would venture to guess that all 50 states do have an alcohol and drug association.
All indicating the importance of drug abuse and alcohol abuse as some of the real problems.
Well, when you consider that 50% of all crime is alcohol and drug related, and we're talking about what we're going to do about crime and all that, if you don't even mention substance abuse in that statement, then you are going in the wrong direction. If we even took care of 25% of that crime, then maybe you could drive down the street without having to lock your door. Maybe you wouldn't have to worry about a drive-by or somebody in your family accidentally getting murdered. That's the kind of situations that we deal with. When our callers call us on the red line, for example, I had a caller, we have a coordinator and an information specialist on the red line, Jackie Jefferson and Rob Hawkins. That's their main function, but the rest of us are trained to be their backups. But we have situations that are considered crisis every day. When particularly a caller I had who had just been shot at the night before with her children in the car and her boyfriend trying to cheat the drug man. And you know, you get these calls and you just want to the emotions go through you because you want to help the person, but at the same time you cannot believe that they would be so stupid as to take a child into a situation like that. And then of course gunshots were exchanged and the child could have easily been murdered as a result of that.
And all of these things lead back to simply substance abuse.
Absolutely, absolutely.
And it's also connected with the healthcare industry.
Yes.
It has a tremendous, I understand, a tremendous impact upon health and all of the methods that we have in terms of delivering health.
Yes, it
all
does.
of these things are affected by substance
it does.
abuse. And so really you're dealing with one of the major areas in terms of societal areas, because if we could deal with things through you, then there are many other problems that we certainly wouldn't have. As
a result of that. But we are happy to say that churches are involved now. When I first started working at the Tennessee Alcohol and Drug Association almost 8 years ago, churches really did not want to deal with this issue because it was a moral thing, but now they've come around to see that there's more to it than just that. And we're also working with a lot more businesses that we have, and we're also working a lot more with the media, because we are trying to form a partnership with
and we're going to talk about that when we come back after this second commercial break. We'll be back with you in just a moment.